Okay, so now we talked about the PA procedure, how it works and what to expect afterwards. Now it's time to talk about the complications or the side effects that can happen after a PA procedure. I think it's important to understand that the PA procedure probably has lower risks and lower side effects than any of the surgical procedures you might consider. So whenever we do a procedure that involves entering a blood vessel, there's always a small chance of bleeding afterwards at the access site in the wrist or the groin. Usually that's what we call a small hematoma that will usually kind of resolve on its own without having to do anything other than just kind of watching it. Anytime you undergo a procedure, you get medications. So you get the sedation medications, the antibiotic, and we use what's called a vasodilator to open up the vessels in the prostate. You can always have a reaction to those medications or the medications we give you afterwards, but those risks are very, very low. Always a chance that you can have a urinary tract infection with any BPH procedure. With the PA procedure, we found it to be about 5 to 7%, usually a little higher on the high side if you have a catheter in place, and we'll give you an antibiotic to try and prevent that from happening. And then the main kind of complication that's specific to a PA procedure is what we call non-target embolization. If the beads or the glue or whatever we use go to arteries that feed other organs apart from the prostate. I mentioned before that the rectum and the bladder and the penis all share their blood supply with the prostate. All the arteries that feed these organs are kind of, interconnected. And so really the skill and the art, I guess, of doing the PA procedure is making sure we navigate those networks of vessels safely and that we send our embolic agent just the prostate. Now that said, the rectum and the bladder have a very robust, we say redundant blood supply to them. And so if some embolic agent is to get to the bladder or the rectum, we probably wouldn't even know about it because those organs really tolerate embolization well. In fact, sometimes we will embolize them on purpose to treat things like bleeding tumors or ulcers or things like that. So at the end of the day, we really don't worry too much about the bladder and the rectum. And indeed, we've really had almost no complications at all related to those organs in all the procedures we've done. So then we need to talk about the penis. The penis does not have such a rich blood flow to it like the bladder and the rectum do. And so if any of the embolic agent gets down into the vessels that feed the penis, you can have damage to the tissue in the penis. We have found over the years about 1.5% of patients will call about a week later describing an area of raw skin, a little bit of tissue at the tip of the penis near the opening that will get kind of raw, and then it may be painful, may not be, usually about the size of a dime. And what that usually means is that some non-target embolization has occurred where either little beads or a little bit of the glue have gotten to the very end of the tip of the penis and temporarily disrupted the blood flow to the skin and caused that skin breakdown irritation. Usually there's really nothing you need to do about it. It's usually pretty minor. Like I said, it might be painful. All you got to do is keep it clean and dry, maybe put some antibiotic ointment on it. And usually by the time we see patients back 1 month after procedure, it's cleared up. Now, in terms of impacts on male sexual function after PA procedure, this is really one of the areas where PA really shines when compared to the surgical procedures out there that can be done for BPH. It is extremely rare for a PA procedure to have any negative impact on erections. We tell people it's far less than 1%. It's never zero, but it's far less than 1%. Patients notice any impact on their erections or their sensation, the neurological sensation of orgasm. Now, it's important to understand that the amount of fluid in the ejaculate, the semen that comes out, will commonly be affected by a PA procedure. Really, anything you do to the prostate, if you embolize it, if you ablate it, you cut it out, do whatever to it you want to do to it, you will decrease the semen production that occurs because the prostate is responsible for producing a lot of the semen that comes out in the ejaculate. So it's common that after a PA procedure, patients will have a decreased volume of semen, or it'll be more watery perhaps. They may even have dry ejaculation. Sometimes they'll notice blood in the semen afterwards. But again, we really don't expect there to be any negative impact on the erections or the neurological sensation of orgasm. Another thing that doesn't happen with the PA procedure is urinary continence. That just doesn't really happen at all. We've seen it maybe one case out of hundreds and hundreds in our experience. And that can happen with some of the other more invasive surgical procedures. So that's a big thing. And apart from that, that's really it in terms of the risks and side effects with the PAE procedure.